Did you know that right now, as you're watching this video, someone in Japan who just had hip surgery 6 months ago is walking up 3 flights of stairs without even thinking twice, while here in the United States, nearly 60% of hip replacement patients over 50 are still struggling with pain and limited mobility a year after their procedure? That's not a coincidence, and it's definitely not about having access to better surgeons or more advanced technology. The difference is something so simple, so fundamental, that it almost sounds too easy to be true. But here's the reality. While American physical therapy often focuses on aggressive rehabilitation that can actually set recovery back, traditional Japanese rehabilitation centers have been using gentle progressive movements for decades that work with your body's natural healing process, not against it. These aren't complicated exercises that require expensive equipment or a gym membership. These are movements you can do right now, in your living room, wearing whatever comfortable clothes you have on. And I'm going to show you exactly 4 movements that will help you walk without pain, rebuild your hip strength safely, and regain the confidence to move freely again, without fear of re-injury. Before we start, drop a comment below with your name and what state you're watching from. I love knowing where my community members are joining me from today. Now, I want you to understand something important before we begin these movements. Your hip joint after surgery is like a delicate piece of machinery that's been completely rebuilt. The surgeons did their part perfectly, but now comes the crucial phase that determines whether you'll spend the next 20 years moving freely or struggling with every step. The biggest mistake I see people make after hip surgery is either doing too much too soon because they're frustrated with their limitations, or doing too little because they're terrified of causing damage. Both approaches will keep you trapped in pain and weakness. What I'm about to teach you is based on principles that orthopedic specialists in countries with the highest successful recovery rates have been using for generations, combined with modern understanding of biomechanics and safe post-surgical rehabilitation. These 4 movements are designed to be done in a specific order because each one prepares your body for the next, building strength, stability, and confidence in a way that protects your new hip while accelerating your recovery. The first movement we're going to do is called the supported hip circle. And this comes from a rehabilitation technique that's been used in Scandinavian countries for over 40 years, with remarkable success rates. Here's why this movement is so powerful for hip surgery recovery. Your hip joint needs to relearn circular motion in a controlled, safe environment before you can expect it to handle the complex movements of walking. Stand next to a sturdy chair or counter, something that won't move if you put weight on it. Place your hand on this support and stand on your non-surgical leg. Now, with your surgical leg, you're going to draw very small circles in the air. And I mean small, we're talking about circles no bigger than a dinner plate at first. Keep your knee soft, not locked, and imagine you're painting circles on the floor with your big toe. Do 5 circles going clockwise, moving slowly and deliberately, then reverse and do 5 circles counterclockwise. The key here is control, not range of motion. You should feel a gentle activation in your hip, but zero pain. If you feel any pinching or sharp sensation, make your circles even smaller. This movement is teaching your hip joint to move in multiple planes of motion, while your brain reestablishes the neural pathways that control that movement. Do this twice a day, and after a week, you can gradually increase the size of your circles by just an inch or 2. This single exercise has helped thousands of post-surgical patients regain confidence in their hip mobility, because it proves to your nervous system that movement is safe. The second movement builds directly on what we just established, and it's called the standing hip extension with pause. This movement addresses one of the most common compensation patterns I see in hip surgery patients, where they start leaning forward and shuffling their feet, because their hip extensors, the muscles in your buttocks and back of your thigh, have essentially forgotten how to fire properly. Physical therapists in Germany have been using this exact progression for decades because it directly translates to better walking mechanics. Stand again with your hand on that same sturdy support, but this time you're going to focus on moving your surgical leg straight back behind you. Here's the crucial part. You're not swinging your leg or using momentum. Instead, think about squeezing your buttock muscle first, and then let that squeeze lift your leg backward. Your leg only needs to come back about 6 inches, maybe less if you're early in recovery. The magic happens at the top of the movement, where you're going to hold that position for 3 full seconds. Count them out loud. 1 1000, 2 1000, 3 1000. During those 3 seconds, your brain is learning to sustain muscle contraction. which is exactly what you need for each step you take when walking. Lower your leg back down with the same control you use to lift it. That's 1 repetition. Start with just 5 repetitions, and I want you to rest for 10 seconds between each one. This isn't about quantity. It's about quality of movement and teaching your neuromuscular system the correct pattern. After 2 weeks of doing this daily, you can increase to 8 repetitions, and eventually up to 12. But never sacrifice form for numbers. Now we're going to address something that almost every hip surgery patient struggles with, and that's balance and weight shifting. This is the third movement, called the lateral weight shift, and it's based on principles from traditional Chinese rehabilitation practices that focus on gradual weight loading. The reason this is so important is that after hip surgery, your body naturally wants to protect that surgical side by avoiding putting full weight on it, which creates a cascading effect of weakness and instability. Stand with both feet hip-width apart, hands resting lightly on your support if you need it. But try to use just fingertips rather than gripping tightly. I want you to slowly shift your weight onto your surgical leg. And here's what I mean by slowly. Take a full 4 seconds to transfer your weight from both legs being equally loaded to having about 70% of your weight on your surgical side. As you shift, pay attention to how your foot feels against the ground. Can you feel your heel, the outside of your foot, the ball of your foot all making contact? Hold that position for 5 seconds, really feeling your hip muscles working to stabilize you. Then take another 4 seconds to shift your weight back to center and over to your non-surgical side. That's 1 complete cycle. The reason we're moving so slowly is that slow movement forces your deep stabilizer muscles to engage, the ones that keep you steady when you walk. Fast movements let you cheat by using momentum. Do this weight shift 5 times in each direction, and if you notice you're holding your breath, that's a sign you're working too hard. Breathe naturally throughout the entire movement. This exercise alone will dramatically improve your walking confidence because you're literally teaching your body that it's safe to trust your surgical hip again. The fourth and final movement is what I call the heel-to-toe rock, and this one is going to tie everything together by specifically training the walking motion while you're still in a stable, controlled position. Think of this as the bridge between rehabilitation exercises and actual functional walking. Stand with your feet hip-width apart, hands on your support, and I want you to focus on your surgical leg. Slowly roll your weight forward onto the ball of your foot, lifting your heel about an inch off the ground. Hold that position for 2 seconds, feeling your calf and front of your hip working together. Then slowly roll back, lifting your toes off the ground so you're balancing on your heel. Hold that for 2 seconds as well. This rocking motion is recreating the heel strike to toe off pattern that happens with every step you take, but we're doing it in a way where you maintain control and can't fall. The brilliance of this exercise, which comes from Dutch physiotherapy protocols, is that it's training your ankle, knee, and hip to work as an integrated chain, rather than isolated joints. Do 10 rocks forward and back, and with each repetition, try to make the movement slightly smoother, like a gentle wave rather than abrupt shifts. After a week of practicing this, you'll notice that your actual walking feels more natural because you've been programming the correct movement pattern into your nervous system. If you feel unstable at any point, it's perfectly fine to put more weight on your support hand. We're building confidence here, not testing your limits. Now let's talk about how to combine these 4 movements into a practical daily routine that will accelerate your recovery without overwhelming your healing hip. Here's exactly what I want you to do. Every morning, right after you've had breakfast, and your body is warmed up from moving around the house, spend 5 minutes going through this sequence. Start with the supported hip circles, 5 in each direction on your surgical leg. Move immediately into the standing hip extension with pause. 5 repetitions with that 3-second hold at the top. Then transition to your lateral weight shifts. 5 shifts to each side with those slow 4-second transfers. Finally, complete your morning routine with 10 heel-to-toe rocks. The entire sequence should take you about 5 to 6 minutes. Then, in the evening, about an hour before bed, repeat the exact same sequence. By doing this twice a day, you're giving your body consistent reminders of correct movement patterns, which is far more effective than doing a longer session once a day. Your nervous system learns through repetition and consistency, not through marathon exercise sessions. As you get stronger over the weeks, you can gradually increase the repetitions, but I never want you to increase by more than 20% in any single week. So if you're doing 5 repetitions of something, next week, you can do 6, not 10. This gradual progression is how you build lasting strength without triggering setbacks. Here's what I want you to understand about these movements and your recovery journey. Every single person who has successfully recovered from hip surgery and returned to walking without pain, traveling without limitations, and living without fear of their hip giving out, did so by respecting the healing process, while consistently challenging their body in small, manageable ways. These 4 movements represent the foundation of that approach. They're not flashy, they're not complicated, but they work because they address the fundamental requirements of hip stability, strength, and coordination. In traditional Japanese rehabilitation philosophy, there's a concept that translates roughly to gradual continuous improvement. The idea that small daily progress compounds into remarkable transformation over time. That's exactly what we're doing here. Each time you perform these movements with focus and intention, you're building a stronger, more resilient hip that will serve you for decades to come. You're not just recovering from surgery. You're building a body that's more capable than it was before the surgery became necessary. So here's what I need from you right now. In the comments below, tell me your name, how old you are, and what state you're watching from. Also tell me how long ago you had your hip surgery, or if you're preparing for an upcoming procedure. I read every single comment, and I'll respond to your specific situation because your recovery journey matters to me. This community is full of people, just like you, who are working to reclaim their mobility and independence, and we support each other through every step. If you found this video helpful, and you want to continue getting exercises and strategies specifically designed for recovery and healthy aging, I need you to do something for me. Look below this video and hit that subscribe button, then click the bell icon so you get notified every time I post a new video. I release new content every week focused on helping people over 50 recover from injuries, build strength safely, and maintain their independence as they age. This isn't about becoming a fitness model or running marathons. This is about you being able to walk through a grocery store without pain, play with your grandchildren without fear, and live your life on your terms. You deserve to move freely and confidently, and I'm here to show you exactly how to do that. Your strongest, most mobile self is waiting on the other side of consistency. I'll see you in the next video.